Don?
Yep, thank you, and welcome everybody. Good afternoon, and for those joining in other time zones, good morning. I'm Don Metz, Health Affairs Executive Editor. I want to welcome you to today's briefing featuring authors from the National Health Statistics Group and the Office of the Actuary at the Centers for Medicare and Medicaid Services. They will present the latest data on national health expenditures through 2022, which we will also be publishing today as an ahead of print article. I will mention this several times, but the embargo time is 4 p.m. Eastern. And again, I will say that again several times, and I think Sue Ducat will as well. For those of you who don't know, the Office of the Actuary produces annual historical data on health spending, which is what we're publishing today. They also publish spending projections data in separate publications at different times of the year. But again, today's publication and briefing are focused on the historical data. The spending data that the Actuary's Office produces annually is an enormous undertaking, represents the gold standard for U.S. health spending statistics, and we're really proud to present this work and proud of our longstanding relationship with the staff at the National Health Statistics Group, which covers many decades. We've been publishing this data really since our inception in 1981. So we're also happy to provide you in attendance with a pre-publication copy of the article. But again, just to remind you, the embargo time is 4 p.m. Eastern. So news stories should not be published prior to that time, 4 p.m. Eastern. Before I introduce the authors, I want to turn it over to Health Affairs Senior Director of Communications, Sue Ducat, who will be your point of contact. She has just a few words that she'd like to say. So, Sue.
Thank you, Don, and welcome everyone. Just wanted to mention that if you do want a copy of the study, I'm happy to email it to you. I posted my email address in the chat, but it's sducat@projecthope.org. sducat@projecthope.org. And as Don said, the study is embargoed at 4 o'clock today. So your story should be also not published. Thank you.
Thank you, Sue. And so let me, before we start, let me just introduce you to the presenters. There are actually a number of folks here today from the Office of the Actuary, the National Health Statistics Group. But for the two, we have two presenters, and then two others as well will join to be available for questions. So again, they're all of our authors today are from the Office of the Actuary at CMS. Again, for them, two will present, and then those two plus two additional will be available for questions. They are Micah Hartman, Ann Martin, Lecca Whittle, and Aaron Catlin. Micah Hartman and Ann Martin will present in that order. And then again, they and the others will be available for questions. All the authors are with the National Health Statistics Group in CMS's Office of the Actuary. Micah Hartman is a statistician there who works primarily on historical, age-based, and state-based national health spending estimates. Ann Martin and Lecca Whittle are both economists who work primarily on historical and state-based estimates. And Aaron Catlin is a deputy director in the group who directs the historical, age-based, and state-based estimates for the national health expenditure accounts. So now let me turn it over to Micah Hartman, who will go first, followed by Ann Martin, and then we will go to questions.
Okay, thank you so much, Don. I want to thank everyone for attending this briefing. My name is Micah Hartman. I'm a statistician in the Office of the Actuary at the Centers for Medicare and Medicaid Services and the lead author of this report. I'm joined by my co-authors, Ann Martin, Lecca Whittle, and Aaron Catlin to present the latest findings from the National Health Expenditure Accounts. We appreciate your attendance at this briefing, and we look forward to your questions following the end of the presentation. The information that we will be discussing today will be published at 4 p.m. in the Journal Health Affairs article titled National Healthcare Spending in 2022, Growth Similar to Pre-Pandemic Rates. Additional underlying detailed tables, definitions, sources, and methods, and other supportive information will be released on the CMS website at the same time. And finally, we would like to acknowledge our coworkers from the National Health Expenditures Accounts team for their expertise and significant contributions to this report. And so we'll move to the next slide to get into the overview of our findings. Leica, yeah, thank you. And so national healthcare spending reached $4.5 trillion, or $13,493 per person, and increased 4.1%. The 4.1% growth in 2022 was similar to the pre-pandemic average annual growth of 4.4% over the 2016 to 2019 period. The share of the economy devoted to health was 17.3%, lower for the second year in a row and down from the peak of 19.5% in 2020. The 17.3% share in 2022 was more in line with the average from 2016 to 2019 of 17.5%. Overall, healthcare spending growth was faster than the 3.2% growth in 2021, but much slower than the rate of 10.6% growth in 2020. This pattern reflects the volatility tied to the COVID-19 pandemic and the significant response by the federal government. In 2022, economy-wide price growth as measured by BEA's GDP price index increased 7.1%, while medical prices measured by the NHE price index increased 3.2%. The economy-wide price increase of 7.1% in 2022 was the fastest since 1981. The number of the insured share of the population reached a historic high of 92% as the number of uninsured individuals fell by 1.9 million. In 2022, Medicaid enrollment increased 6.1 million, Marketplace enrollment increased by 1.7 million, and employer-sponsored insurance enrollment increased by 1.5 million. And we move to the next slide, we see annual growth in GDP in blue and the annual growth in NHE in red, and the share of the GDP that is devoted to healthcare spending in purple. Looking at the recent trends, in 2020, the NHE accelerated substantially due mainly to unprecedented COVID-19 supplemental funding and public health spending, while at the same time, the GDP declined. The result was that the share of the GDP devoted to health reached 19.5% in 2020. In 2021, the economy rebounded and the overall demand for healthcare increased following restrictions on elective procedures and visits in 2020. But this increase was far outweighed by the reduction in COVID-19 supplemental funding, and the NHE slowed from 10.6% in 2020 to 3.2% growth in 2021. In 2022, the NHE returns to a rate of growth and share of the economy that is similar to pre-pandemic rates. In addition, we created a green line to show growth in national health spending after removing spending from other federal programs and federal public health. These two spending categories contain the vast majority of the COVID-19 relief funding. This was done to give you a sense of the impact of the COVID-19 funding that it had on the health spending and the magnitude and direction of healthcare spending without these two spending categories. The differences between the red line and the green line have decreased over time as the pandemic supplemental funding has become smaller. And on this slide, we have highlighted other federal program spending and federal public health activity in green, so you can easily see the spending amounts that were removed from the NHE before calculating the growth on the green line on the previous slide. In addition, we provide other federal spending by type of good or service, such as for hospital care or physician and clinical services, to show the impact of other federal spending at a more detailed level. Prior to the pandemic, other federal program spending was a small share of the NHE, and federal public health activity spending was much lower than state and local spending for public health activities. But taken together in 2020 and 2021, the federal response to the COVID-19 pandemic was unprecedented, and we show substantial increased other federal spending by service and federal public health activities. By 2022, the COVID-19 supplemental funding has almost completely gone away, and total other federal program spending is similar to the level that it was in 2019. But federal public health activity spending still remains much higher than it was in 2019. On this slide, we show annual growth in economy-wide prices in black, annual growth in personal healthcare prices in green, and annual growth in national healthcare prices in red. Personal healthcare is a subset of the NHE and represents healthcare goods and service categories such as hospital care, physician and clinics, and retail prescription drugs. Price growth for the NHE and personal healthcare picked up in 2022, but we're still much lower than the price growth for the whole economy. What we have observed is that price trends for some medical goods and services, especially those paid for predominantly by health insurance, such as Medicare, Medicaid, or private health insurance, may not follow those trends in the overall economy, as prices for some medical goods and services are often set in advance through legislation, regulation, or contractual agreements. Examples of these types of medical care with these trends would be hospitals and physician and clinical care. At the same time, some medical goods and services that receive a smaller share of their payments from health insurance, such as dental services, other non-durable products, or durable medical equipment, can react more quickly to underlying price inflation, and those experienced higher price growth in 2022 compared to 2021. And on this next slide, we show the sponsors of healthcare spending, or the businesses, households, governments, and other private revenues sources that ultimately pay for healthcare spending in the United States. Often the shares by sponsor remain relatively stable year to year. However, the share of the federal government spiked in 2020 due to the COVID-19 supplemental funding, federal public health spending, and federal Medicaid payments. The share of federal government spending has come down in 2021 and 2022 as much of the COVID-19 funding from supplemental funding from the Paycheck Protection Program and the Provider Relief Fund has gone away. However, it is still higher than it was in 2019, due mostly to federal payments for Medicaid and federal public health activities. On the chart on the right, you can see the federal government spending growth on the red line. The spike in 2020 following a decline in 2021 and low growth in 2022. For federal government spending growth, both 2021 and 2022 were well below the growth for other sponsors and also that of the NHE. On this slide, we show the overall nominal growth in NHE over time with the blue line, but also use the stacked bars to represent the type of payer's portion of the growth. For example, the red portion of the bar shows the share of the annual increase in the NHE that is from health insurance spending. In most years, health insurance is the largest contributor to the growth in the NHE, but due mainly to the impact of COVID-19, the green and the purple, which is the portions of the bar, were much higher in 2020. And the green represents other federal programs and the purple is public health activities. This was due to the supplemental funding and federal public health spending. As that funding declined in 2021 and 2022, health insurance and all other payers and programs accounted for all of the growth in the NHE. This slide illustrates the distribution of healthcare spending in 2022 and growth in healthcare spending from 2019 to 2022. The majority of spending comes from personal healthcare at 83%. This is the spending for goods and service categories such as hospitals, physician and clinics, and retail prescription drugs, just to name a few of them. You can see that overall growth was faster in 2022 at 4.1% compared to 3.2% in 2021. The 4.1% growth was similar to the 4.3% growth that you can see on this exhibit in 2019. You can also see that personal healthcare spending slowed in 2022 at 4.0% compared to the 5.5% growth in 2021. So with personal healthcare growth slower in 2022, we look to other areas in the NHE that drove the faster overall growth, which were the turnaround in the net cost of insurance and the much smaller decline in public health spending in 2022. The net cost of insurance is the difference between the revenues for health insurance plans and benefits paid. This difference contains administration spending, taxes, fees, and net underwriting gains or losses. The net cost experienced volatile trends in 2020 and 2021 due to the COVID-19 pandemic and the health insurance industry tax. The net cost increased in 2022, and the share of the spending going to medical benefits returned to a share that was more comparable to shares seen prior to the pandemic. Taking a look at the distribution of healthcare spending by payer, we can see that health insurance is the largest category at 72%. The smaller pie to the right shows these different types of insurance and their distribution, which include private health insurance, Medicare, Medicaid, Veterans Affairs, Department of Defense, and the Children's Health Insurance Program. Looking back at the larger pie on the left, out-of-pocket payments were 11% of total spending in the NHE. And in the NHE, out-of-pocket payments include the consumer payments for copays, deductibles, cost sharing, and other healthcare paid directly out of pocket. This spending does not include the payments by individuals for health insurance premiums. And finally, other third-party payers and programs, public health activities, and investment accounted for the remaining 18% of spending in 2022. Now that we've looked at the distribution, we view this slide to highlight the growth in healthcare spending by type of payer from 2019 to 2022. Starting with the total on the left, we can see that overall national healthcare spending growth was 4.1% in 2022, which is much closer to the 4.3% growth in 2019 just before the pandemic. While the growth in 2020 and 2021 shows the volatile patterns due to the impacts from the pandemic and related government response. We will discuss the largest three payers, private health insurance, Medicare, and Medicaid, in more detail later on in the presentation. With that being said, other things to mention are the strong rates of growth in out-of-pocket spending in 2021 at 11% and the 6.6% growth in 2022. Dental services, durable medical equipment, and physician and clinical services accounted for 34% of out-of-pocket spending in 2022. And other third-party payers and programs, which is 8% of the total national healthcare spending, shows the spike in 2020 as the other federal programs, which include that COVID-19 supplemental funding, increased dramatically in response to the pandemic. You can also see the impact of the supplemental funding declining in 2021 as well as in 2022. And on this slide, we provide enrollment for the major health insurance categories, the count of the uninsured, and the share of the population with insurance over time. 2022 was the highest recorded share of the population with insurance at 92%, with records going back to 1987. The number of uninsured has dropped for the third consecutive year to 26.6 million in 2022. All three major types of insurance increased enrollment in 2022. Most of the increase for private health insurance came from marketplace enrollment with a 1.7 million increase, and employer-sponsored insurance with a 1.5 million increase. Medicaid enrollment increased by 6.1 million people in 2022 and by about 18 million people since 2019. And I want to thank you, and I will turn the remainder of this presentation over to Ann Martin.
Thank you, Micah. For the following portion of the presentation, I'll be discussing trends for the major payers as well as the main service sectors. Starting off with private health insurance, in 2022, total spending for private health insurance reached $1.3 trillion, which was approximately $71 billion or 5.9% more than the amount spent in 2021. The rate of growth, however, was somewhat lower than in 2021, when private health insurance spending increased 6.3%. Private health insurance enrollment grew 1.5% in 2022, and this was the fastest growth in enrollment since 2015 and reflected increased enrollment in both marketplace plans and employer-sponsored insurance. On a per enrollee basis, spending for private health insurance increased 4.3%, which was slower than the growth of 5.9% in 2021. This was due primarily to slower growth in per enrollee spending for employer-sponsored private health insurance. In addition, private health insurance spending for medical goods and services, which accounted for 90% of total private health insurance spending, experienced slower growth in 2022 compared to 2021. The slower growth was due to spending for hospital care, physician and clinical services, and dental services. For all of these categories, expenditures grew more slowly in 2022, following a much stronger increase in 2021, when growth in private health insurance medical spending rebounded after declining or slow growth in 2020. At the same time, the net cost of private health insurance, which represents the difference between revenues received by private health insurers and the amounts paid by those insurers for medical care incurred, increased 8% in 2022, which was a turnaround from a decline of 18.7% in 2021. On the next slide, we'll take a look at overall Medicare. Medicare spending reached $944.3 billion in 2022, increasing 5.9%. This was slower growth than in 2021, when spending increased 7.2%. Total Medicare enrollment increased 1.9%, which was slightly faster than the growth in 2021 of 1.7%, but still slower than the growth rate in previous years. On a per enrollee basis, Medicare spending growth also slowed, increasing 3.9% in 2022, following faster growth of 5.4% in 2021. The slowdown in Medicare spending was primarily driven by slower growth in spending for hospital and physician and clinical services. This follows a rebound in spending growth in 2021 after a drop in utilization during the pandemic. In 2022, factors driving slower growth for Medicare hospital care included lower price updates and a decline in inpatient hospital utilization, including fewer COVID-19 admissions that had carried an associated 20% add-on payment. For Medicare physician and clinical services, slower growth was influenced by a slowdown in utilization, as well as the elimination of the 2021 temporary physician fee schedule update factor of 3.75%. Turning to the next slide to look at fee-for-service Medicare, fee-for-service accounts for 50% of total Medicare spending, while private health plans make up the other half, which we'll look at in the next slide. Fee-for-service Medicare spending declined 1.9% in 2022 after increasing 3.8% in 2021. This continues a trend of slow or declining growth that has been seen over the last few years. The low trends can be somewhat explained by enrollment, which has been declining since 2019. In 2022, enrollment declined 3%, following an even larger decline of 3.8% in 2021. Much of this can be explained by beneficiaries switching from fee-for-service to Medicare Advantage. On a per enrollee basis, fee-for-service spending increased just 1.1% in 2022. One factor that influenced this trend was the lower overall utilization of services after the dip in 2020 and subsequent rebound in 2021. Lower utilization trends are in part a result of reduced average morbidity. That is, after COVID-19's impacts on the Medicare population, a generally healthier population remains. Another factor contributing to lower fee-for-service per enrollee spending is the impact of dual eligibles enrolling in private health plans. These enrollees tend to have higher average spending, so by shifting to Medicare Advantage, this leads to lower average fee-for-service per enrollee spending. Now on to Medicare private plans, known more commonly as Medicare Advantage plans. Spending and enrollment growth for Medicare private health plans has continued at a strong pace, and in 2022, these plans accounted for 50% of total Medicare program spending and 46% of total Medicare enrollment. In 2022, total spending for Medicare private health plans increased 15.1%, following growth of 11.5% in 2021. This was primarily due to strong enrollment growth, coupled with spending per enrollee increasing by 6.1%. The faster growth in per enrollee spending in 2022 was a result of mixed trends. Per enrollee spending for personal health care services slowed, while at the same time, per enrollee spending for the net cost of insurance accelerated. The trends in the net cost of insurance for Medicare private plans was similar to the trends experienced in the net cost of private health insurance, which fluctuated due to impacts of the pandemic, as well as from the presence or absence of the health insurance industry tax. Turning our focus now to Medicaid. Medicaid spending reached $805.7 billion in 2022, an increase of 9.6%. This was approximately the same rate of growth as experienced in 2020 and 2021, and the third consecutive year of growth above 9%. Enrollment growth in Medicaid also remained strong in 2022, growing 7.2%. Faster Medicaid enrollment growth since 2019 reflects the newly enrolled, as well as enrollees who have remained in the program due to the continuous enrollment requirement of the Families First Coronavirus Response Act. On a per enrollee basis, Medicaid spending increased 2.2%, following a decline of 1.5% in 2021. Per enrollee spending remained low on average in 2021 and 2022 due to the large number of qualifying children and adults who enrolled in the program. These enrollees tend to have lower average spending per person than elderly and disabled enrollees. Within services provided by Medicaid, there was faster growth in home and community-based waivers, which was offset by slower growth in hospital care spending. On the next slide, we show federal and state and local Medicaid spending separately. This graph illustrates overall 9.6% increase in Medicaid spending was driven by the combination of 10.8% growth in federal Medicaid spending, which accounts for 71% of total Medicaid, and 6.6% growth in state Medicaid spending. The double-digit growth rates in federal Medicaid spending in 2020 through 2022 are attributed to rapid growth in Medicaid enrollment and the associated temporary 6.2 percentage point increase in the federal medical assistance percentage, or FMAP, under the Families First Coronavirus Response Act. In order for states to receive this increased federal match rate, they had to adhere to the continuous enrollment provisions and not disenroll Medicaid beneficiaries. Turning now to focus on the services or where the nation's healthcare dollar went. The $4.5 trillion in healthcare spending went primarily towards hospital care, which was a 30% share, physician and clinical services, which was 20%, and retail prescription drugs, which was a 9% share. Together, this accounted for 59% of total healthcare spending. In 2020 and 2021, some services received larger amounts of COVID supplemental funding than others. Additionally, COVID supplemental funding increased total national health spending levels in those years. As a result, the shares of total health spending for some services may have fluctuated compared to previous years. However, by 2022, supplemental COVID funding was greatly reduced, and the shares of services in relation to total health spending are more in line with historical trends. To take a closer look at the three largest services, we'll start with hospital care. In the graphs for the services, we show the breakdown for the main contributors to the growth rates. The dotted black line shows that total hospital care spending increased 2.2% in 2022, which was a slower rate of growth than the previous 2 years. Breaking down the contributions to the overall hospital growth rates, the blue portion represents health insurance, where payers such as Medicare, Medicaid, and private health insurance. The red portion represents out-of-pocket spending, such as deductibles and copayments, and the green portion, which is labeled other third-party payers and programs, represents smaller private and public programs. In the National Health Expenditure Accounts, this is the category that includes the Paycheck Protection Program loans and provider relief funds, also known as federal COVID-19 supplemental funding. In 2020, growth was entirely driven by the increase in other third-party payers and programs as COVID supplemental funding was introduced. At the same time, out-of-pocket spending and health insurance spending both declined, driven by reductions in use, particularly for routine and elective procedures. In 2021, supplemental COVID funding was still provided to hospitals, but the amount was not as large as in 2020. This decline, coupled with increased health insurance spending due to a rebound in utilization of services, led to a 4.5% rate of overall growth. In 2022, spending for hospital care by all of the major payers slowed, and federal supplemental COVID funding continued to decline. In addition, overall hospital price growth slowed slightly, while inpatient days and discharges both declined, all of which were contributing factors to the slower growth. Next, for physician and clinical services. Spending grew 2.7% and reached $884.9 billion in 2022, which was a slower rate of growth from 5.3% in 2021 and 6.6% in 2020. In 2020, like hospitals, growth was driven by the increase in other third-party payers and programs, which includes federal funding for COVID-19. In 2021 and 2022, increases in health insurance contributed more to the overall growth than did other third-party payers and programs, as use of services picked back up. In 2022, slower growth in physician and clinical spending was driven by slower growth among the major payers. Also, prices for physician and clinical services slowed in 2022, increasing 0.5% compared to 2.3% growth in 2021. And on the next slide, we'll look at retail prescription drug spending. Spending for retail prescription drugs reached $405.9 billion in 2022, which was an 8.4% increase from 2021 levels and faster than the increases in both 2020 and 2021. These drugs include prescription medications purchased in a retail setting and does not include drugs purchased as part of a hospital stay or visit, or drugs that are purchased and administered in a doctor's office. In 2022, growth was faster due to an acceleration in Medicare and out-of-pocket spending and strong growth in Medicaid spending. Utilization, as measured by the number of prescriptions dispensed, increased at a faster rate in both 2021 and 2022, contributing to the faster growth in overall retail prescription drug spending. Also contributing was an increase in prices after 4 consecutive years of declines. Finally, looking at the other services, we can see the impacts on growth resulting from the introduction and subsequent decline of federal COVID supplemental funding, mainly the Provider Relief Fund and the Paycheck Protection Program loans. Other professionals, dental services, home health, and nursing care facilities account for about 14% of total national health spending. For all 4 of these services, the supplemental funding for COVID-19 drove spending growth in 2020. However, in 2021 and 2022, when that funding declined, growth was driven primarily by health insurance and out-of-pocket spending, as the use of services increased, especially during 2021. And turning to the last slide, in summary, national health spending grew 4.1% in 2022, a slightly faster rate than in 2021 when spending increased 3.2%, but much slower than the rate of 10.6% in 2020. After the volatile patterns that occurred in health spending since 2020 that were primarily linked to the COVID-19 pandemic and the federal government's response to the public health emergency, the 4.1% growth in 2022 resembles the pre-pandemic average annual growth rate of 4.4% during 2016 through 2019. The federal government's response to the public health emergency in the form of supplemental funding for healthcare providers led to a large increase in health spending in 2020. However, in 2021 and 2022, very little of the additional COVID-related federal funding remained, and spending growth was lower. The slowdown over both of these years was evident in spending patterns for hospital and physician and clinical services. However, for retail prescription drugs, which were not impacted by supplemental federal funding, spending growth accelerated in both 2021 and 2022. Growth in healthcare spending in 2022 was also influenced by continued strong growth in Medicaid and private health insurance, partially resulting from strong growth in enrollment. Finally, the health share of GDP also returned to nearly pre-pandemic level in 2022 of 17.3%, which is similar to the average share of 17.5% during 2016 to 2019. Thank you for your attention, and we'll be happy to take your questions.
Thank you, Micah and Ann, very much for the presentations. And I just want to remind folks that Leica Whittle and Aaron Catlin are also available for questions. I want to also thank the National Health Expenditure Accounts team, the whole team, for the outstanding work behind this. Just a reminder to everybody, the embargo on the paper and the information lifts at 4 p.m. Eastern today. We do have time for questions. If you have questions, we would ask that you use the raise hand feature in Zoom, and I will call on folks, and if when I call on you, please do state your name and your organization. So I see a question from Joyce Frieden. Joyce, you're on mute, but please go ahead.
Yeah, hi, can you hear me?
Yep.
Yes.
Yes.
Great. Thank you. Just a quick question. I think early on you said by 2022, COVID-19 supplemental funding was almost completely gone, but public health activity spending still remained much higher than in 2019. And I wonder if you had any insight on why.
Yes. So, Leica, we could go back to the fourth slide, and while we're getting there, that is true. So, if you look here, we've highlighted two of the categories here in green. So the total other federal program expenditures, which is the sum of other federal programs plus we've highlighted the Paycheck Protection Program loans and the provider relief funds. And you can see that those were not in existence in 2019 and then came on in 2020. And then the spending amounts were lower in 2021, and they've almost kind of gone away here in 2022 with just $2 billion for the provider relief fund. So then you can see how that kind of tracks with the highlighted green line there with the expenditure amounts for the category total other federal programs and expenditures. But if you look down at the federal public health activity, you can see in 2019, prior to the COVID-19 pandemic, that the spending was about 13.3 billion for the federal, which was much lower than the 95.1 billion for state and local public health activities. And as we progress through time, you can see the expenditure amounts for federal public health activity were much higher in 2020, but they did come down in 2021, so they were lower, but still higher than the 2019 level. And then in 2022, still at this, still lower than the year before in 2021, but higher than the 13.3 billion. And the spending that is being accounted for there in federal public health activity would be spending for different things through HHS and also through CDC, the agencies there. And we're talking about things like grants to states for vaccine development and stockpiles, discretionary funding for testing, and also surveillance and other things related to public health activities. So if others on the team have more to add to that, but that's where the spending is mainly concentrated in terms of the federal agencies and where we are at this level at 92 billion in 2022.
Okay, thank you.
Sure.
Thank you. And Kathleen Gavin has a question. Make sure to unmute.
There.
Oh, there you go. Yeah, thank you.
Okay. Sorry about that.
That's
I thought
all right.
I had done that. Yes, I'm Kathleen Gavin from the McKnight's Business Daily. Could you explain a little bit why nursing homes reported a 7.8% dip in spending last year and what this year's growth represents following that blip?
Yeah, like if we could go back to the chart that has nursing home and some of the other payers.
So what I can say about that is that nursing homes consists of a lot of Medicare and Medicaid spending, and we saw declines in Medicare spending in 2021. Also, what's really driving that dip in 2021 overall is the decline in other third-party payers and programs. As you can see, the green portion of the bar declines a lot. That's because they received a lot of money from COVID and in 2020 from the supplemental federal funding, and that declined. It went from $20 billion in 2020 down to about $3 billion of the supplemental funding in 2021. So most of the decline is coming from that category.
Okay, thank you.
Okay, Eric Gunn has a question.
You. Why do durable medical equipment and dental services seem to respond much more to inflation? That was noticeable in the data that was presented.
Yes, thank you for your question. And so what we've observed is for some of the larger payers, some of the larger goods and services, particularly services such as hospital, physician, and clinics, the negotiations and contractual arrangements and other legislative requirements that are set in advance kind of set or lock in some of those prices that you'll see in those areas in any given year. But in some of the other areas, like we've noted in the article, for durable medical equipment and non-durable medical equipment, the products that are being sold are not under those same restrictions or same negotiations, and so they're going to have the potential to react more quickly to the price increases and the economy-wide price growth that we've seen started to see in 2022 and starting in 2021.
Thank you. Are there any other questions? If no other questions, maybe I'll just ask one to just give folks another minute to see if they have other questions. I did wonder, I just wanted to ask about the paper mentions the historic high insured rate of 92% and talks a little bit about the continuous enrollment requirement as a factor, and maybe I have to wait for the projections, but I'm just wondering if the expiration of the continuous enrollment requirement, if you have any sense of what effect that might have on the uninsured and insured rates in 2023. And again, if I have to wait for the projections, that's fine, but I was just curious.
Yeah, and so what we could say, and kind of what we touched base on in the article, is the enrollment growth that we did see in Medicaid over that time period through 2022. So, like, if you could pull up the enrollment slide, number 11, but just to say, enrollment increased by 24.6%, or about 18 million people over the period that we're showing here, on this slide. And so a lot of that, as Ann mentioned, was related to the Family First Act. So, but the report just takes us up through 2022. So what we have measured here and what we can show and kind of discuss and highlight is the impacts through 2022 and how significant they were up to that point. And of course, as you've mentioned, Don, that the act does expire in 2023. So we'd have to go to the projections to look at the impacts of that going forward.
Okay, thank you. Any other questions? If not, Eric Gunn, another question. Yeah.
Thank you. I'm just looking also at the higher levels of insurance and wondering what kind of role, if you can say that the Affordable Care Act and the expanded access to the marketplace might have played in that in that particular trend.
Yes.
Yes,
So,
you can see.
go ahead.
No, I was just going to say, as you can see from the chart here, that Marketplace did play a big impact. The increased enrollment there from 2021 to 2022 on the private health insurance enrollment trend, and that was due to increased subsidies and lower premiums for some individuals. Sorry to cut you off, Micah.
Yeah, and I would just say that the faster growth we mentioned there, increased premium subsidies, via the American Rescue Plan Act, and also additional efforts to increase enrollment for eligible folks in 2022, specifically led to some of that increase that we're seeing there from 2021 to 2022, specifically for Marketplace.
Okay. Other questions? Oh, Joyce Frieden, another question.
Yeah, hi, Joyce Frieden, MedPage Today. You did talk a little about growth in physician services, and it seemed, if I'm remembering this right, the increase was slower in 2022 than 2021. So I was hoping for a little more elaboration there.
So in physician services, the number one contributor to the deceleration was Medicare, which decelerated from 13% growth in 2021 to 6.8% growth in 2022. But among all of the major payers, spending growth slowed down. A lot of that has to do with a slower growth in utilization coming off the rebound of increased service use in 2021, which followed the dip in 2020. So a lot of what you're seeing is just coming down from the large bump up in 2021. But also price growth was a contributor. It only increased 0.5% after a little bit higher growth of 2.3% in 2021.
One thing that I'll add, in addition to what Ann just covered and what's on the chart, in the article, we also talk about independently billing laboratories, which is included in this category, and that showed slower growth as well and pulled down that growth rate due to lower amount of COVID testing in 2022.
Thank you. And we have a question from Casey Quinlan.
Thank you. I was just wondering if you could comment at all on how those, utilization rates might affect hiring in healthcare, especially because, there have been all of these, basically all these people leaving healthcare recently and all this hiring going on in healthcare. I'm wondering how that might affect, the ability to hire folks.
Yeah, that's not something in terms of the details that we get into in the spending report that we have here. Is not something that we track directly in terms of like hiring and that relationship between utilization and some of the business decisions that the healthcare providers are working through.
I understand. Thank you.
Any other questions? Just remind folks that there are a couple notes from Sue Ducat and from the CMS press office in the chat. If you're interested in copies or getting in touch with folks, please do read those chat messages. If no other questions, just a reminder again that the material is under embargo until 4 p.m. And I think if Sue Ducat, if you have anything else to add before we close formally?
No, I am fine. I see that there's maybe one more question from Peter.
Oh, okay. I don't see that on my screen, but if there's a question, yeah, please.
Hello,
Yep.
Peter Werwine with Managed. Sorry.
That's right.
Peter Werwine with Managed Healthcare Executive. Could you discuss the net cost of insurance going up? Perhaps review what goes into net cost of insurance. Is there any way that reflects growing profits? And also, is there a connection, or could you discuss a possible connection between the fact that the insured population is at an all-time high, and we're seeing this increase in the net cost of insurance?
Sure. Thank you for your question. And just to start with the definition for the net cost of insurance, what we're tracking is, the total revenues that private health insurance, private Medicare, private Medicaid plans. So the total health insurance industry, we're tracking total revenues, and we also track the benefits that are paid. And the difference between those two is what we would call the net cost. It's going to include administrative costs for administering the healthcare plans. It's also going to include any taxes or fees that the plans face. And in addition to that, what would be included in there would be any underwriting gains or losses. And so in the insurance industry, those would be amounts that are remaining, and after they've collected the revenues and accounted for those other categories. And in some cases that would include profits depending on the situation, or losses. And so what we've seen recently, a couple things really impacting the net cost and the health accounts really would be the pandemic. COVID-19 pandemic had a significant impact on the net cost. And the main reasons for that was in 2020, the utilization overall of the healthcare sector was lower than maybe was anticipated going into that year. And so with these rates and other things set in advance, there was a larger difference between the revenues collected and the amounts that were paid out for benefit spending. And then if you go into 2021, still speaking about the pandemic, we had this rebound of pent-up demand, and some of the elective procedures and the moratoriums on some of this type of healthcare rebounded in 2021. And so there was a decline in the net cost, again, with these rates being set in advance, but utilization being higher compared to 2020. And then when we get into 2022, coming off of this decline, we're getting back to an area where the net cost ratio, which would be the share of the net cost over the total revenues, is getting back to rates that we saw prior to the pandemic. And the growth rate is in line with what we've seen prior to the pandemic. So that's kind of where we stand in 2022 in terms of the COVID-19. The other impact that we saw in the area of net costs would have been with the health insurance tax. And so in 2021, the health insurance tax was permanently repealed, and so the impacts of that went away compared to it being there in 2020. And so there was no health insurance tax in 2021 and in 2022. And as I mentioned, health insurance tax would be another expenditure category that would have been included in the net cost.
Any other questions? I don't see any hands up. I'll give it just a second. With that, I do want to thank everyone for being here and for your interest. And I want to thank again Micah Hartman, Ann Martin, Leica Whittle, and Aaron Catlin, and the entire National Health Expenditure Accounts team for this important work. We are, I think, formally adjourned. Again, thanks so much.
Okay, thank you.
Thank you.
Thank
Thank
you.
you.